I've been using Suki now for approximately 10 months, and my first impression was that I was not going to go back to the way things were. I have enjoyed it tremendously. It's made a big difference in my workflow, my ability to see add-on patients. It's decreased my workload significantly, particularly when it comes to documentation time. Yeah, I would say on average when it comes to time saved and volume, I'm able to add 2 to 3, maybe even 4 extra patients a day. I'm saving time per note, I would guess 3 to 5 minutes per note, which adds up. Over the day, you're saving an hour, hour and a half in time spent typically documenting, dictating, typing, etc. It has allowed me freedom to be more present with my family, and certainly I don't think about documenting at home ever. It's all done within the working hours, and so I can enjoy my evenings with my family. I've always been a people person. I enjoy that human-to-human interaction. So it does take me away from the computer screen more. I'm less concerned about jotting down notes or making sure I don't forget something, because Suki's there to capture that, and I'm able to focus on communicating with the patient. My patients have embraced Suki into the practice. They're very understanding that I'm a busy mom physician, and I would say that on the heels of the COVID-19 pandemic and some of my leadership roles where they see me around the community, they're actually excited to see the burden of typing and documentation lifted. They've watched that and grown with me over the years and gone from handwritten notes to typing to dictation and now the AI software, and they enjoy it, and it's a fun part of the practice. When it comes to documentation in my notes, certainly things that might have been mentioned in passing, I'll pick up on the end of the day when I'm editing the notes, and I think, I need to follow up on that. There might have been something that previously was just mentioned offhandedly and maybe I didn't notice it as important. So it's helped with documentation there, or even reminding me if in that moment I said I was going to order a test but I didn't turn to the computer and enter it, then Suki is there with the reminder that, hey, you said you were going to get this test, and I'm able to do it. So it's also a safety net to make sure that the plans that we form in the exam room actually are carried out. As far as Epic integration with Suki, that's been really ideal. I have the Suki app on my phone, so I just get consent at each visit with the patients. They talk, and then when it's over with, we've had the visit, I can simply press a button. And I know you can edit in the app. That's not my preference. I want to edit in Epic. It's just instantaneous, so there's no cutting from another app or pushing it over to a different software. They work harmoniously where I don't even think about them being separate. It's just I finish the exam room, and when I'm done, essentially the note is there in Epic, and it's very user-friendly and not cumbersome at all. In encoding patient interactions, it's important when you're billing to document the level of interaction that you have with the patient. So many times I'm managing chronic conditions where the patient will bring chronic things up during the visit, and we touch on them, and maybe that wasn't the primary focus of the visit, but we did, discuss it, and I provided counseling for it. So Suki is able to pull those things together in a summary format with suggested diagnoses at the end, and sometimes you find yourself like, yeah, I did touch on those 2 or 3 things. So it can increase the complexity of the note to really capture what you were doing and almost remind you that, we did touch on several things that maybe in my mind were not as important as the primary complaint, but in reality, they are a part of taking care of a patient as a whole. So I think it's a wonderful way to keep that organized, and so you can see increased capture of the work that you're doing. When I'm talking to people about why you should try Suki, I tie it back to burnout, to the administrative burden, to all the things that we've lived the past couple of decades as medicine has evolved. We know as physicians and also the providers that it's really gotten onerous, the amount of data entry that we have had to do that takes us away from our patients. This is a way to free us back to the way it used to be, the way where you're just talking to your patient and providing that care on a one-on-one basis. I would say that it's not difficult. It's quite easy to download the app and get started. I did not have any difficulty. Suki provided the support in integrating it with Epic. It literally took a couple of minutes and it was hooked up immediately. If you're thinking about it, if you're feeling burned out, if you're tired of being behind on your notes or missing activities with your family or friends because you've got to stay up another night with the laptop in your lap, that's the person who should definitely try this.